Attempts are underway to increase the number of medical workers in the health system and further improve their skills. The federal government is offering free training courses to some registered nurses so they can provide intensive care support, while work is also underway to try and encourage former nurses and doctors back into the profession. Here's national medical reporter Sophie Scott. Hi, Sophie. So how many more medical staff are needed to cope with the outbreak as it continues?
Well, at the moment, it's not like we're in short supply, but what they're doing is just making sure that as the demand increases, the supply of medical staff is there. So there's 32,000 nurses in Australia, and so what the government's offering is to train 20,000 of those to be able to work in ICU, so dealing with the sickest of patients where it's one-on-one nursing. And all that training will be provided free of charge to any nurse who wants to do it, and also online as well. So they're making it as easy as possible. The health authorities have also asked, just today, they've sent an email out to any doctor or nurse or midwife or pharmacist whose registration has elapsed in the last 3 years, asking them if they want to come back and help out as well, because a lot of people let their registration lapse either for retirement or they might move into an academic position. They might just decide to do something else for a short time. But those people have skills that really could be needed. And so that's been a big call out to all those professions to say, if you want to help, we would love your help. And it follows similar call-outs that's happened around the world.
And is there a great willingness among former health workers to return to work, Sophie?
Yeah, look, there really is. The people we've spoken to a couple of nurses who said they'd be really keen to come back. Doctors who said that they would move from like an academic position back into helping out. And it's not like they necessarily need to go to the front line of medical care. They could even do sort of behind-the-scenes stuff or the telehealth consultations that we've been talking about in the last few days as well. So there's lots of scope there for people who do want to help out, and it's the demand's not there at the moment, but what they're doing is making sure that as if the number of cases increases in Australia, we've got the medical workforce ready and trained to meet that need.
Sophie, there does seem to be cautious optimism that the curve of cases is flattening. What's your reading of where we are now with the outbreak?
Look, we've been hearing a lot about this flattening the curve idea, and it's all about the reduction in the number of cases every day. And what's been happening is about 2 weeks ago, we were seeing 25 to 30% jump every day in new cases. And now in the last few days, that's down to about 9%. So I'd say there's cautious optimism that the measures are working. There is a lag in the time it takes for these measures to take effect. So the authorities are hoping that the measures that have been put in place this week, which are the strictest so far, will see the results of that in about another week or two. So fingers crossed, but it's too early to take our eyes off the game. But there is cautious optimism that what we're doing at the moment is working.
Sure. Sophie, thanks.